there's any place in all of Lancaster, the Southeast section, without a doubt, has become almost a United Nations of people. And with that brings challenges with language, challenges with culture, and without a doubt, too, challenges with employment and healthcare problems.
These people here in this area is in dire need. They're in dire need of the services that the Southeast Health Center offers.
Southeast Lancaster Health Services is one of the agencies that provides an identity and a presence for the Southeast community of Lancaster. It is one of the agencies that is a player in the lives of the people who reside here.
A lot of the people here are literally apprehensive to go to a large hospital outside of the ward. Intimidation, they see it in their own eyes. They just feel comfortable in this neighborhood.
You don't see big bulletin boards or big posters out saying, come to Southeast Lancaster Health Services. People come here because they feel like they are going to get fair treatment, and they feel more comfortable with people who are going to help them through the process.
Good afternoon, how are you?
Most people who go through the healthcare system have a lot of fear, a lot of anxiety, a lot of worries about it. If they can come to a building and to people that they already trust, it takes away a lot of that anxiety.
The trust factor, I believe, from our perspective, the dental clinic, has come from consistency. Consistency of being here for them, consistency of letting them know you're not going to hurt them, and showing that in the word gets out that you're not going to hurt them, or you're a gentle dentist, or whatever the case may be.
And one of the things that's nice about the fact that we have walk-in schedules, bilingual staff, and things like that, except Medicaid, Medicare, sliding fee for those who are uninsured, is it facilitates the development of that trust between the patient and us.
I see this agency as almost above all other social service agencies in the city, and I hesitate to say that because there are a lot of good ones. But this one provides a sense of human dignity.
There are people who are sensitive to the community. There's a lot of caring individuals who are involved in the process, and I'm a patient here. I could go anywhere in the city if I really wanted to, but I'm a patient here because it's the closest thing to the old family doctor that I've ever experienced in my adult life.
It's preventative health care primarily, and in that sense, it contains health care costs and adds to the quality of people's lives by minimizing. If these health issues that are being dealt with in this facility are not dealt with at this level, those issues, those health issues, will mushroom into more serious physical problems.
Okay, yeah.
Everyone who walks in this door, 95% we can take care of without involving specialists, without involving other physicians or other groups.
And there are a number of chronic illnesses in this area, such as diabetes, hypertension, and others that are basically undiagnosed, untreated. And many times when we can find them from our side, and there are things that we ask in terms of questions of medical history, that we can pick these things up.
I took a tour of the Southeast Health Services a couple years ago and was physically moved by what I saw being provided in these facilities. Every square inch was being used efficiently and beautifully for what I consider to be essential services to this community.
The United Way Board has reviewed and approved the capital campaign for Southeast Lancaster Health Services because you cannot dispute the numbers.
We have over 6,000 medical patients, which had over 19,000 visits. And on the dental side, we have over 2,500 patients who've had over 4,000 visits, so that together We have over 8,500 patients and over 23,500 visits in a given year.
It's the interaction between staff and community that you know. You don't need a performance audit. You know it's working.
You know, when a young person sees their doctor or their nurse or the receptionist in the grocery store or at the mall and they say, "Mommy or Daddy, there's the person who took care of me when I was sick," that has a very powerful effect on the whole community.
There are a lot of children in this neighborhood, a tremendous number of children, and those children need a lot of services, particularly the health services.
One of the biggest issues that we face is the fact that we have so many young people parenting, so many young people who need skills themselves, who have or are responsible for someone younger than themselves, whether it's their own baby or another sibling in the same, you know, a brother or sister.
Instead of superficially treating crime when it gets there, or some of the teenage pregnancy when it gets there, and all of the issues, literacy, the ability to get a job, all of those issues are impacted by education. And if you are sick, if your learning disability hasn't been picked up, if your vision problems, your hearing problems, you haven't been immunized, you're not going to be in school. If you're not in school, you're not educated. If you're not educated, it's going to impact on the rest of your life.
If they can be provided with proper prenatal care and also have the emphasis that education is important to their lives, then hopefully through that they're able then to focus on getting an education versus, am I going to be pregnant again?
Families are families, whatever they are. So as far as I'm concerned, the patient sets up what their family is, and my job is to strengthen that family any way I can.
And I think most of the clients coming in are proud folks. And to come in and to be treated like some bureaucrats treat people looking down. These people don't do that. They treat them with dignity, and therein lies the whole point of the situation of they need to be here because the people are in, again, dire need of these professionals, and they are the epitome of professionals.
There isn't a hair of difference between a man or a woman that is sitting out here and myself. We all want to be trusted, to have dignity, to have our word and our honor intact, to be able to provide for our families. That is where dignity and love come from, right? The ability to turn around and to provide for those you love and to be a part of your community, to positively contribute to your community. That's where our sense of who we are comes from. And if people are denied the ability to do that, it demeans them. And if it demeans them, then it demeans the spirit of this city.
I come here to tell the truth. Know what the people is myself. I'm talking to the bottom of my heart. That if not was for this clinic, Dr. Knapp, and from the love of God and the grace of God, I don't think I'm being here sitting down talking to you people.
I don't know that I can create hope in anyone. What I can do is help them help themselves. Show them that what they do, what they are, going to school, all of that will make a difference in their life down the road. So I sometimes help show by example in what I'm doing. Sometimes I give suggestions or ask them to give suggestions. Sometimes it's purely educational, and you never know when that spark is going to hit. You never know who it's going to hit. You never know what is going to happen. You just continue trying, and you continue doing the best that you can do.